Welcome to the BCYR Practitioner Training. We know that sustained maternal distress, anxiety and depression during pregnancy has significant long-term health impacts for the developing fetus. The high levels of maternal cortisol that result from sustained distress directly affects the developing fetal nervous system and can result in poorer birth outcomes such as preterm delivery, small birth size and the associated morbidities. In addition to low birth weight and preterm birth, research now shows that this maternal chemical dysregulation is associated with childhood behavioural problems, poorer cognitive functioning in the infant, and a generalised susceptibility to adolescent psychopathology, all of which can have a cumulatively trajectory of lifelong consequences for the child. These include childhood behavioural problems, learning difficulties, and adolescent mental health. Additionally, it can result in infant developmental disorders and diseases manifesting in childhood and chronic diseases later in life, such as diabetes. There is now mounting evidence that these effects may even be transgenerational. Now let's take a look at this graph that shows the relationship between Australian non-Aboriginal and Aboriginal populations by age. The yellow lines show the non-Aboriginal Australians and the blue lines show the Aboriginal population. You can see that the age bracket between the ages of 0 to 25 years is when the proportion of Aboriginal Australians peak compared to non-Aboriginal Australians. It is almost twice that of non-Aboriginal Australians. It is also when young Aboriginal women are most vulnerable to increasingly high levels of distress, anxiety and post-traumatic stress and are at the peak of their reproductive years. This is also when Aboriginal infants are most vulnerable to the epigenetic effects of their environment. It makes sense that we should focus more health dollar and attention towards culturally safe resources and programs for young Aboriginal women, their infants and families if we are to improve the imbalance in health outcomes. If poorly managed, perinatal depression and anxiety has snowballing adverse effects for the mother, the child and the family as a whole. Postnatally, maternal depression and anxiety can disrupt maternal attachment with her infant and result in additional cognitive and behavioural problems for the developing child. It must also be said that paternal depression has its own independent trajectory of associated negative consequences for the infant, similar to those associated with maternal postnatal depression. For example, both men and women who are depressed might engage in more high-risk behaviours such as substance abuse, neglecting their child, or displaying hostility toward their child. Whilst there can be little doubt that a number of divergent opinions exist today regarding the impacts of past government policies and the consequence of trauma and intergenerational trauma experienced by many Aboriginal people, there are two quite distinct views that I will highlight. On the one hand, for many non-Aboriginal peoples who have grown up in a society where their views have been more highly valued, there is difficulty entertaining the possibility that terrible events such as massacres, attempted genocides, the staggering impacts resulting from the stolen generations and ongoing racial abuse were ever really that severe or indeed ever happened. On the other hand, there are many Aboriginal people who have struggled to survive. The impacts of intergenerational trauma, social and economic inequities, daily experiences of racism and so on, for them there is a need to understand how it is possible for a group of people to continue acting in this way against another. Comprehending the unthinkable is a difficult task when the power of denial and repression provide an easier alternative. However, hearing, understanding and incorporating Aboriginal history, the trauma of the past and the present, into the psyche of all Australians is painful and it can be emotionally provocative, but it is necessary if we are to prepare the way for future generations to live in a society of acceptance, understanding and harmony with one another. To provide the best healthcare and future for Aboriginal Australians, clinicians need to strengthen partnerships with those they are caring for. We must all deepen our own cultural knowledge and design services that are culturally respectful and culturally safe. It has been well demonstrated in culturally safe environments, Aboriginal people are empowered to manage their healthcare needs. And we can't lose sight of the fact that health equity is very much a clinical issue. The progress in addressing this has been slow and in some cases even regressed over the decade of closing the gap strategies. The difference in life expectancy between Aboriginal people and non-Aboriginal people in WA is 15.1 years for males and 13.5 years for females. Child mortality rates for Aboriginal and Torres Strait Islander people are 3.5 times the rate of non-Indigenous children. Low birth weight is more than twice as common among babies born to Aboriginal and Torres Strait Island mothers compared with non-Indigenous in WA. Potentially avoidable mortality rates for Aboriginal and Torres Strait Islander people are 4.6 times higher than non-Indigenous people. And Aboriginal and Torres Strait Islander people are hospitalised 1.4 times the rate of non-Indigenous people and are 10 times more likely to discharge themselves against medical advice. We must all ask ourselves, what sort of cultural bias do I carry? What are the impacts of these on Aboriginal families? How deep is my understanding of the impact of colonisation and its intergenerational impacts? And what is the time frame that it will take to heal? If we are to improve outcomes for Aboriginal mothers, infants and their families, we simply must work together to do things differently. Recognising, promoting and strengthening culture, cultural practices and language throughout the delivery of healthcare services and encouraging greater access to culturally appropriate health and supportive services is a great beginning as we move towards enhancing a parent's protective factors. We need to take the most care to get it right for Aboriginal mothers, fathers and families in these critically important early years. This, by necessity, involves actively working to strengthen family systems of care, and this approach will form the basis of a new approach to improve future health and wellbeing of Aboriginal people. But it cannot be achieved unless we fully recognise the legacy of intergenerational trauma on the social and emotional wellbeing of Aboriginal and Torres Strait Islander people. The general level of risk in some communities is already high, and there are far fewer opportunities for children, for example in high-risk families, to be buffered by other protective influences within the community. As you can imagine, it is very difficult for a community to hold the infant in mind when everyone is suffering. Given the levels of grief, loss and trauma suffered within many communities, it is not surprising that some Aboriginal people feel a sense of isolation and disregard by broader society, and struggle to find a sense of pride in the face of the negative images and stereotypes commonly portrayed in media and encountered in everyday life. We must work together to strengthen family systems.